Good day everyone, this is Dr. Shaista Sariwal, Specialist Obstetrics and Gynecologist and Cosmetic Gynecology in Middle East Hospital Segaya. What's gestational diabetes? The gestational diabetes means the increase in the blood sugar level in your body during the pregnancy, and it will be disappear after the delivery of your birth of the baby. What's the risk factors? The risk factor is most common and very important during the gestational diabetes, like maybe patients that have spontaneous abortions, the macrosomic baby means enlarged size of the baby during the pregnancy. There is neonatal hypoglycemia, neonatal hyperbilirubinemia, and then neonatal respiratory distress syndromes. The mother, she can be developed like preeclampsia, and they have anomalies during the pregnancy, and then baby can die during the pregnancy because of the high blood sugar level or uncontrolled blood sugar levels. In the prevalence of the diabetic is not only increasing in the Gulf country, but in the worldwide always increasing. Not the prevalence on the type 1 diabetes, but in the reproductive age of the mothers, they are increasing the type 2 diabetes as well. If you have for the management we have to go like in the two ways to diagnose. Either you already diagnosed like with the insulin level and you are already taking the insulin or medications, so you have to consult with the joint clinic like endocrinologist, like they are controlling your sugar levels, or your obstetricians. Either you have to go for once a week or twice a week, you have to go for the regular checkup, and you have to check your eyes, and then you have to check your kidney as well. The second way, if you are pregnant like 20-24 week of the pregnancy, the weeks, and then you have to be consult with your doctor. They will advise you like the glucose test. The one glucose test like 50 gram glucose tolerant test, 8-hour fasting. This is only the one time of the blood sugar you can check. The other is the glucose tolerant test. The one is very common. We are advising all our patients like 75 of the gram of the glucose. So this will be like taking for the 3 hours. In case this sugar level is high and then you have symptoms like you are thirsty, you are drinking more water, and you are tired, and then you are going toilet, passing the pee more frequently, please consult with your doctor as soon as possible. Thank you so much.